We are back on Taking Care of Business on Koerner Radio, News Talk, 1180, 1230, KGEO, 1410 KERI, and now 1000 KKIM in Albuquerque, New Mexico. Our guest by phone, author, president of the Pacific Research Institute, Sally Pipes.
You know, Sally, just finishing up a little bit on the Medi-Cal issue, recently the governor announced a 10% cut of reimbursement to physicians, which is going to cause a lot of physicians to not want to treat patients. And the second thing that's happening is Healthy Families, which was a government-sponsored program, is being terminated, and they're rolling all the kids over to Medi-Cal.
Right. No, that is exactly. You know, I've written a lot about the impact on access to doctors with the Medi-Cal and Medicaid reimbursement rates. And in fact, out of the 48 million Americans who are so-called uninsured, it doesn't mean they don't get health care, but who don't have health insurance at one particular point in time. Of that 48.3 million, 14 million are eligible for Medicaid and CHIP and have not signed up. And the reason is because I think the reason in the main is that a lot of these people would rather turn up at an emergency room, which, as you know, is expensive care, because they can't find doctors to take them. Because, right, even today, Medicaid is reimbursed between 35 and 42% below what a doctor gets for treating a private patient. It's even lower than the 20% cut in doctors treating Medicare patients. So, you know, it's going to be a huge problem, and it's going to put more and more people on Medi-Cal and Medicaid, you know, turning up at an emergency room, and not because they won't be able to find doctors. And we've actually seen that happen in the state of Massachusetts, where Romney Care came into being on April 1st, 2006.
Do you think that's one of the reasons why Romney lost, is because he couldn't differentiate himself from Obama when it came to Obamacare?
Well, I do. I mean, I think, you know, I was a person who was critical of the pending legislation back in January 06, which, of course, was signed April 1st, 06, and a lot of the things that I had projected that would happen did happen. And unfortunately, you know, during the campaign when Romney became the candidate against Obama, for some reason, he did not want to say, you know, yes, I did sign Romney Care into law. Now that it's been around for 6 years, we've seen a lot of things. Wait times increase, premiums be the highest in the country in Massachusetts, people not being able to get access to doctors. And so, you know, it seemed like a great experiment. We have experience. It didn't work. And therefore, if it didn't work in the state of Massachusetts, I don't want this for the rest of the country. And because Romney Care was a microcosm of Obamacare, we don't want to go down that path. But for some reason, he wouldn't do that. And it was interesting, during the three presidential debates, the issue of health care reform was mentioned hardly at all. And I think it's because Romney knew if he pushed Obama on Obamacare, that Obama would have come back and said, well, you know, the person that really was behind both laws, John Gruber, professor of economics at MIT, he would have got killed on that. But if he had just taken that step and said, you know, it was an experiment, it didn't work, I think he would have certainly done a lot better. But that was just one of the many things I think that, you know, didn't play out well in the actual election results on November 6th.
Well, unfortunately, the election's behind us, and we're going to have to live with it for the next 4 years. But just finishing up a little bit on this Medi-Cal program, one of the things that irritates me is currently I'm in the process of doing an enrollment with one of my groups of 600 employees. It's in the service industry, and so they have a lot of people from other countries that are working for them at lower wages, and they do offer a strong benefit package, but all of these people are on Medi-Cal. Now, I personally don't think this is right, but what can I do about it? Nothing. It's just that these entitlement programs are destroying not only the country, but specifically California.
Well, you're absolutely right, and I think one of the things that's very much in the news these days is, you know, on January 1st, 2014, the individual mandate and the employer mandate come into being. And on the employer mandate, you both know that an employer with 50 or more employees will have to either provide health insurance or pay a fine to the government of $2,000 per employee. Now, the average employer, their their family plan is costing them about $15,700 a year. And so, I think a lot of employers are going to say, well, we'd rather pay $2,000 per employee fine, and our employees can purchase their health insurance in these state-based exchanges rather than pay, anywhere between $7,000 for an individual and $15,000. And so, remember the president said over and over again, if you like your health insurance plan and you like your doctor, nothing will change. Well, people are already starting to see things change, and as the CBO said, Congressional Budget Office said, up to 20 million Americans are going to lose their employer-based coverage. Or Doug Holtz-Eakin, former head of the CBO, said up to 35 million. McKinsey, the consulting firm, said 1/3 of the 160 million Americans who have employer-based coverage could lose it. And so that's a big issue. The second is that the HHS, the Health and Human Services, has said that a full-time employee is anybody who works 30 hours a week or more. So people in the service sector, just like you were talking about, people in the restaurant business, people that hire a lot of part-time people, I think we're going to see a lot of these employers cut the hours worked per week from 30 down to, say, 27, 28, so that they won't be forced to provide health insurance. And we've seen companies like Darden, Red Lobster, Papa John's all say that this is what they're going to do because the cost of Obamacare is just too much.
We're having a conversation with author and the president of the Pacific Research Institute, Sally Pipes.
Now, I understand, Sally, that in addition to the $2,000 penalty that the employer would pay, if they did elect to give benefits to an employee, and then that employee elected to drop from the employer group but go to the exchange, that it's a $3,000 penalty per employee that goes to the exchange. Is that correct?
Yes, that is correct. And also there's the issue of, it gets a bit complicated, but what percentage of your wage is going to, what percentage of your wage is going to be is the cost of your health insurance. So I think it's 9.25%. If it's above 9.25%, then the employer would also pay that $3,000 fine.
Even if they supply benefits.
Right, exactly.
Well, now isn't that 9.25 or 9.7?
9.5. It's 9.5 actually.
All right, 9.5. Isn't that based on family income, or not, rather than just the employee's income?
Yes, the family income. Right.
How does an employer find out what the spouse is making,
well,
or the domestic partner?
And big government has to be looking over your shoulder. It's going to be very, very hard, and people will be very creative about providing that information. And people don't want to provide the government with a lot of information. They feel it's an invasion of their privacy, and it is.
Now, if an employee elects to roll into the exchange, or the employer terminates their group plan and says, okay, you can go to the exchange, I'll pay the $2,000 per employee fine, then are there subsidies, and how much are they, and where do they come from? Right.
Well, there are, and so the issue will be, so if you are below, if you're an individual or a family that is 133% below the federal poverty level. For an individual, that's an income of about $14,800. For a family, it's about $30,600. So if you're at that income level, you would then go on to Medicaid. But between 133 and 400% of the federal poverty level, so for an individual, that's an income of about $45,000. For a family, it's about $94,000. So you are then eligible on a sliding scale for a subsidy from the federal government to purchase your insurance. The question will be, in the exchanges, there are going to be 4 types of plans: bronze, silver, gold, and platinum. Different fee structures, different deductibles. But we saw on the Tuesday before Thanksgiving, HHS brought out what is an essential health benefit plan, and I think we're going to see a lot of employers say, we cannot, with what we have to provide an insurance plan and stay in business. So it's going to be very interesting. And I saw just the other day where Mark Bertolini, the head of Aetna, said people are going to see a huge increase, maybe up to 100% in their premium increase. And even Blue Shield of California said they just didn't think, you're going to be able to keep these premiums down to the level that Kathleen Sebelius would like. So this is a huge issue that's going to come into being on January 1st, 2014, and we don't even know whether the states that are setting up the exchanges, whether state or federal or partnership exchanges, whether the states will be ready to offer the insurance plans by the deadline of October 1st, 2013. I mean, it's been very, very slow and difficult. And certainly we've seen it in California, California was the first state to take, funding to set up the exchange, and it's been very, very slow and difficult there. It's called Covered California is the program for our exchange.
The other thing, we're going to run out of time in a second, but on the small group side, it's the young people that are going to see the biggest increase in rates versus the older people. Right,
and they are going to select then to pay, starting in 2014, the individual mandate, the tax for not having health insurance is only $95. It rises to, or 1% of income. By 2016, it rises to $695 or 2.5% of income. You're going to see a lot of young people say, hey, I'd rather spend, pay the tax of $95 and just take my luck and not purchase insurance. And then you've got a lot of older people who are going to be calling on the system, which is going to raise costs even more.
Mm-hmm. When we come back, let's again talk about Newport Beach and talk a little bit more about the employers being forced to put their employees part-time. We'll be back in a moment on Taking Care of Business on Koerner Radio, News Talk 1180.